So welcome. Welcome everyone. And from today we are going to start another important topic from the gross anatomy, that is our thorax region. So from today we are going to start the thorax, and in today's session we'll be discussing the skeleton, or the basically the thoracic cage, and the bony part of the thoracic cage is what we are going to discuss today about the skeleton. So we are going to rapidly revise important questions, and volatile facts will be covering, high topics, and obviously most expected topics. They all will be covered in this particular session. Beneficial for the university exams as well as PG exams, NEET PG, INI, or next PG, right? So these are sort of questions. So describe the anatomy of typical rib can come as a question. Classify the bones of thoracic skeleton and describe the anatomical features of sternum. So sternum. So these osteology, they come not only in your theory, but they are very, very important for your practicals or Viva OC. Okay, when you give that Viva, so there are two big stations in practical exams. One is this osteology part, and one is the soft tissue part, right? So one of them is this. So and the question can come regarding the joints, about the ribs, the first rib, differences between the ribs, thoracic inlet, clinical importance of the xiphoid process. So all these things we'll try to cover in this particular session. These are why to choose Auricle. These are all the features of Auricle. You can go from all the type of classes, all the different type of sessions, hard copy notes, QBank. We have the practical sessions as well. These are all the subscriptions. You can go through them. They range from 3-month time period to around 4 years. And below you can see the code is Dr Ankit 20 for various other discounts on these subscriptions. Okay, you can just go through that, or you can even take the screenshot of this particular slide and just check it out. Okay, there are various important features in this Oracle platform. Okay, let us come to the topic over here, and the topic is the skeleton of the thorax. So before going to notes, I would just like to discuss a bit, or give you an overview of what we are going to cover up in this particular session. So as we all have seen that the name of the session is we are going to deal with the skeleton of thorax. So we should know that what are the different bones in this, and then what are the different joints which they make, and what is their practical use. Okay, so bones, and how do the bones they articulate with each other, that is the joints. And apart from that, about its practical use, or their main this mechanism of the movement. So their yeah, I just write the practical use of it. Okay, so that is what we are going to discuss. But I will like you to take all of you a bit more backward meaning by to have a bigger picture. So if you look at a bigger picture, then you will see that, okay, thorax, or the skeleton of thorax, we all know it is a thoracic cage. So we have the posteriorly, what we have number of vertebrae over here, right? So we all know about the vertebral column. There are various number of vertebrae. In thorax, we have around 12 vertebrae. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So we have 12 vertebrae posteriorly. In between the vertebrae, or in between the vertebral body, we have the intervertebral disc. So that is so this is what I'm trying to make is the posterior aspect of the skeleton or thoracic cage. So understand these are the 12 vertebrae. So we have T1 over here, we have T12 over here. In between them, we have the intervertebral disc. Okay. Now, what is attached to the vertebrae are the 12 pair of ribs. So we also are having the ribs over here. So we will have the first rib going like this. Okay. Then we'll have the second rib going like this. Likewise, we have the ribs. And finally, what we will be encountering is, I'm just roughly making it like this. So we will have this 12 pair of ribs. Now these ribs, they directly or indirectly, except from the lower two, which are the floating ribs, they are attached onto anteriorly situated, we can say a bone, and again a bone, that is our sternum. So anteriorly over here, we will have a sternum over here. So just imagine this is the anterior part. Okay, this is the red color highlighted part which I'm trying to make over here. This is the anterior part. This is the sternum over here. Okay, so these ribs, most of them, or upper 10 ribs, they attach to this sternum over here. This is the sternum. and that is the ribs. Now, barring lower two ribs, T 11, 11th and 12th ribs. So lower two ribs, let me write over here, the lower two ribs, they are floating ribs. So they don't go anteriorly, right? They are floating ribs. This, I guess, most of us know. But there's the overall framework is we have a thoracic cage. So main bones involved over here, as you can see, is the ribs, right? Then we have the vertebrae, and then we have the sternum. These are the major bones which we see in the thoracic cage. Now, there are various bones. How many bones are there? See, 12 pair of ribs, 24 bones already, 12 vertebrae, 24, and 12 comes out to be 36. Then you have sternum, 37. So you imagine you have around 40 bones in the thoracic cage. So obviously, there will be a lot of joints over here, a lot of joints. And most of the joints are synovial. So they move. They have slight mobility, or not slight, they are quite mobile. So what is the practical use? The third point was what is the practical use? Now, what type of joints are there that we'll discuss already, but as I said already, most of the joints are synovial. So what is the practical use? For that, we have to understand that I always say that understand why and then how will be clear. Why we have a thoracic cage, why we have a structure like this. If you look at the entire body, for one more second, if you look at the entire body, we have the head over here, the neck over here, and we have the upper limb over going on the sides. Then we have this whole trunk part, thorax, abdomen, and then we have the lower limb. This is the body. Okay. This part is T for thorax and A for abdomen. So we call this thorax and abdomen as the region of the trunk. Okay. Abdomen has what? Abdomen has a lot of organs. A lot of organs ranging from liver, kidney, intestine, all of that. They are obviously very important organs, and but in abdomen there is nothing like a rib cage. There's nothing like a rib cage in abdomen. If you look at the rib cage, below it is empty. The lower part of the trunk, there is no rib cage. Because here, in the abdomen, for respiration, you need just the main, and for the protection of organs, you need the abdominal wall. That is in itself sufficient. Abdomen has organs like liver, kidney, intestine, all of that, and spleen and stuff like that. But remember that most of these organs, mainly the liver, they are under the cover of the thoracic cage only. So if you try to understand, then liver will be mostly under the cover of the thoracic cage. This will be the area for liver. What you see normally in abdomen or behind the abdominal wall is you can mainly understand that here we have the small intestine on the center. On the sides, we have the large intestine. These are major structures which are exposed, and they are protected by the thick abdominal wall. That is part of abdomen. So what about the rib cage now? The thing with rib cage is what are the organs which are inside the thorax? That we all know we have the heart in the center, and we have a pair of lungs. Both of these are so important that if there's any damage to any one of these, it is obviously life-threatening. Immediate life-threatening could be there. Therefore, we need to protect these organs. Yes or no? Protection is needed. So that protection is provided by the rib cage. Protection is done by the rib cage. Fine. Now, what is the most important organ in our body is the brain. So brain is also covered by the skull. But what is the difference between the normal functioning of brain and the heart and lungs? The brain actually is not mobile. It's not a dynamic organ. It's normally sits on its own and it's doing the activity. The neural connections going on, but it is not a dynamic organ. But on the other hand, the heart and lungs, they are dynamic organs. Lungs, respiration, inspiration, expiration, heart, again, heartbeat, 70, 80, 90, 100 per minute. So therefore, for protecting the heart and lungs, we need a rib cage, but we also need them to be sort of dynamic structure, or therefore the joints are mainly synovial, so that whenever you slightly jog or run, there's chest expansion and chest incursion, excursion, all these activities. They can only happen if you have a bony structure that can actually move around. It's a bony structure, and therefore there are so many bones that when they articulate with each other, there has to be some movement in them, so that they are serving both the purposes. The purpose number one of the rib cage is that it is protecting very important organs. Obviously, the heart and lungs are more important than the intestine. So they are protecting very vital organs, heart and lungs. Secondly, they are protecting, and they are the organs, and also they are not hampering the functionality of the heart and lungs. So protection as well as the function both are served by this sort of anatomy, that is the thoracic cage. So you have a cage, you have ribs in between, you have a gap so that the ribs can expand when you take a deep breathing. That is why we have a rib cage and most of the joints are synovial. I hope the point is clear. With this understanding, we can understand now the basic anatomy of the thoracic cage. Okay, so as you can see, or you can understand in other way also, that if you look at the sternum has some parts in it. Okay, we have the upper part of the sternum that is known as the manubrium. It is known as manubrium. Then we have the major part of the sternum, which is known as the body of sternum, and the lower part of sternum that is known as the xiphoid process. Xiphoid process. This is present anteriorly. You can actually palpate it and feel it. In front of the chest, we have this bone. This line over here between the manubrium and the body, this you can actually feel. So this area which I'm making arrow, this is at the top of the sternum. You can see this gap over here, right? That is known as suprasternal notch. So it is above the sternum. So it is known as suprasternal notch. So you can obviously feel it. And just go below, or you start palpating the manubrium. If you just go below, and just after 4 to 5 centimeter, you feel a transverse ridge. That is a junction of manubrium body. It is known as sternal angle. Known as sternal angle, also known as angle of Louis with S silent. That is the point. This you can feel. Okay, then you can keep on palpating, and lower you can feel, and that is a xiphoid process. Okay. Now, this is one thing. Now, on the sides of the ribs, now try to understand in the beginning only that the sternal angle is a very important bony anatomical and surgical landmark in the anatomy of the thoracic cage. Why? Number one is the rib that is attached to the sternal angle, which number rib it is? It is second rib. So that helps in counting of the ribs. Okay, that helps in counting of the ribs. The moment you can palpate the sternal angle, then the moment you move your finger laterally, this is what you're palpating the second rib. So you can narrow down 3, 4, 5, 6, 7. Okay, its seventh rib is the last rib that is directly attached to sternum. Then what comes 8th, 9th, and 10th? They are attached below the seventh rib. So these will be 8, 9, and 10. 8, 9, and 10. 11th and 12th, I told you, they are floating. They don't reach anteriorly. So they start from the T11 and T12, but they are like this only. They are just floating ribs. They are like this only. Okay. Now, there's one more thing over here. What is that? That if you understand, then this will be the second rib, and here you will have the first rib, obviously, and above you have the which bone is attaching at the upper part of the sternum, that is a clavicle, a bone of upper limb. So clavicle is attached over here. Now see what happens is the length of a sternum. If I try to make a lateral view, suppose left lateral view, understand. Suppose you are viewing at the camera, you view at me like this. Imagine you are viewing at my thoracic cage. This is the interior part, right? This will be the interior part, and this will be the posterior part. Now, if you look at the sternum on the sides, okay, it appears like this. This is the sternum, lateral view. But on the same time, if you look at the thoracic vertebrae, 12, so they have an anterior concavity. So thoracic vertebrae, they appear like this. So you can understand that the thoracic volume or thoracic cage, it has different dimensions anteriorly and posteriorly. You can imagine the posterior, it is quite longer, or it's a huge height compared to the anterior, that is the sternum. So you have the T1 to T12 over here, and this is sternum. So what it also tells us that it tells us the obliquity of the ribs. The ribs are oblique in direction. Oblique. The ribs are not horizontal, they're oblique in direction. You can understand the first rib coming around like this. You can understand that, okay, here you have the seventh rib coming, then you have the eighth rib going, the ninth rib, the 10th rib, and the 11th and 12th will be over here. And here you have the second rib, third, fourth, fifth, and all that like this. So the ribs are oblique. This also you have to understand. They are not horizontal, they are oblique. Okay, and this whole region will be known as you can call it as the thoracic volume. So this whole region from here to here, this is where we this is the volume of the area, or not the area, but the volume of the thoracic cage. Thoracic cage. It doesn't mean that heart and lungs will occupy totally. That is also one point. As I told you over here in the previous image, that here you can imagine the liver. There's a whole liver. Simultaneously, here you will have the stomach. Behind you will have the spleen over here. Okay, and in posterior you will have the kidneys which are lying over here. They are go a bit lower down also. Just try to imagine that the thoracic cage, though we call it as a thoracic cage, but it is not only housing the heart and the lungs, but their abdominal organs also. We have a liver, we have a spleen over here, a spleen over here. We have the stomach covered by the liver. We will have the kidneys over here. So in fracture of the lower ribs, it is not always okay that the lungs and the pleura will be getting involved. It is the abdominal organs that can also be involved. The practical use, understand. If the lower ribs are damaged, there can be, though there are actually high chances of damage to the organs like liver, like spleen. Stomach might be protected as it is covered by the liver. Then you have the kidneys, they are present posteriorly in front of T11, T12, all those vertebrae. Okay. The upper part or upper two-third part is actually totally occupied by the lungs on both the sides. And obviously the heart will be slightly over here, tilted towards left. But yeah, that is all there. The heart and lungs are there, but these organs are also there. And separating the heart and lungs from these abdominal organs is which group of muscles? What do we call it as? What is this over here? What is this green colored muscle over here? This is the diaphragm. It's known as thoracoabdominal diaphragm. Now listen my words very carefully. It tells us that thoracic cage, it does not entirely, or it is not the distinguishing point of thorax from abdomen. Because inside thoracic cage, we have abdominal structures also. And this green color diaphragm, which I'm trying to make, it is a muscular diaphragm. This is known as thoracoabdominal diaphragm. I'm writing T dot A dot. It is thoracoabdominal diaphragm. This is the structure or group of muscles which are separating the actual thoracic organs above with the abdominal organs below. It is thoracoabdominal diaphragm. The thoracic cage upper two-third or say upper three-fourth area is covered or is totally filled up by the lungs and the heart, but the lower one-third or one-fourth, you can say one-third, is having the abdominal organs also. We have to understand this. I hope they got the point. And it is like a cylinder. So thoracic cage will be like a cylinder. What do you mean by cylinder? Cylinder, let me try to show you over here. If you look at the upper part of the thoracic cage, it is very small over here. We have the T1 vertebrae over here, and we have the sternum over here. But as you go down, you have the structures going like this. The area covered by the ribs, they keep on increasing. So you have what? We have a thoracic inlet and outlet. That is a confusing topic in itself. Why? Because this upper, or you can say the upper aperture of thoracic cage, this upper aperture, right? From the above, upper aperture, and this is the lower aperture. Lower aperture. Now see what is actually the problem over here is, we have keep on using the terms like thoracic inlet and thoracic outlet. Right now, I will tell you the anatomical perspective, but I will also tell you the clinical perspective or the surgical perspective. The upper thoracic aperture is known as the thoracic inlet. I'm bracket writing A anatomically. And the lower aperture is known as the thoracic outlet, but there is nothing like inlet and outlet. In bracket, I'm writing A for anatomically. Why? Because inlet means everything is entering inside. But from this aperture, the things are coming out also, like arteries. So we can't completely call it as thoracic inlet. But yeah, just for the sake of confusion, we started calling it as thoracic inlet. Lower aperture is known as thoracic outlet. But now, clinically, because a lot of we can say the diseases are for the structures which are coming out of it. So clinically, it is known as thoracic outlet. And bracket I'm writing clinically, so that you are aware of this also. So if there is a tomorrow you will study diseases like thoracic outlet syndrome, then those syndrome are related to upper aperture, thoracic outlet syndrome. But anatomically you should know. But it's just a game of word. You should know which aperture is what and what it is formed by. That is the point. I hope this point is clear. So now we have a good overall idea of what this thoracic cage is made up of, what are the different bones, how do they function, and practically it is not only the thoracic organs but the abdominal organs also come into it, right? So these are the basic things. Now let us turn to the notes wise and just go through the basic idea of the or the bit of details of the thoracic skeleton or thoracic cage over here. So let us start with the sternum and its parts. Okay, just give me a second. Right. So sternum is a flat bone located in the anterior aspect of chest. It is palpable. It is midline of chest and has a sort of T shape. The sternum parts has three parts that we have discussed. It has a manubrium upper part. It has a body, a larger part, and a very small xiphoid process. Manubrium is a superior aspect. So let us try to draw also it side by side. So this was the manubrium, this was the body, and this was the xiphoid process. So manubrium is a superior aspect and it is trapezoid shaped. It is a depression called jugular notch. What is that jugular notch? Jugular notch is nothing but the same suprasternal notch. So this notch is also known as jugular notch. Jugular notch, also known as suprasternal notch, because it is above the sternum. You can feel it. The sternoclavicular joint is present, as we have seen from the upper limb that here we have the sternoclavicular joint at the top. Which type of joint it is? It is a saddle variety of synovial. And manubrium articulates to the body by forming the sternal angle. That also I have told you already that this transverse ridge and this you should all palpate. So you should actually, if you are not aware by now, you should be aware. From now you should be aware how to count the ribs. Well, that creates a very big problem if you are not aware of it. So first of all, palpate the jugular notch, very easy. Go below for a few centimeters, you will feel a transverse ridge. That is a sternal angle. And the moment you move your finger laterally, that is a second rib. Very simple as that. You can count your entire ribs. You count till 10th rib anteriorly. Easily. From second to low down, you can count the 10th rib over here. Okay, so it is at the level of second costal cartilage. Now, what is this costal cartilage that we'll see? See, what happens is actually the ribs as a bone, they don't directly come to the sternum. So when the ribs, they reach over here, and between the ribs and the sternum, you have this small piece of costal cartilage. So we have all this costal cartilages over here. We have all this costal cartilages over here. I'm trying to make different colors. These will be the costal cartilages. Okay, then attached are the bones actually. So body sternum elongated and flat and spaced for 3 to 6. So as I told you that upper 7 ribs are attached directly. So if we write the number, the 1 is over here, 2 is over here, 6 and 7 over here. 8, 9, 10th, they are below the 7th rib. Xiphoid process is the most inferior part and tip is located at the level of T10. So yeah, xiphoid process is at the level of behind. If you go, then we have the T10 vertebrae. If you go at the horizontal level, okay, there are a bit of ribs over here. There is frequently asked question in your BioOC, typical and atypical ribs. You should know what are typical ribs and what are atypical ribs. So a rib, you'll see in an image also that the rib is obviously it is covered like that. Anterior part of the rib, if you imagine, then you will have the costal cartilage attached to it. But if you look at the posterior part of the rib, then this hole becomes the, you can say, the body of the rib. Then where it angulates is known as the angle of the rib. It angulates at two spaces, so posterior angle and anterior angle. But posteriorly, where as it is attaching to the vertebrae over, this is, imagine the V for vertebrae. Here you have the head of the rib. And rib not only attaches to the vertebral body, but it will also attach to the transverse process of the vertebrae. So if you are not aware, let me try to show you that if you look at the typical vertebrae, you have a body. Okay, if you look at transverse view, this body is located anteriorly. Then you have a pedicle and a lamina, pedicle, lamina. So this is P for pedicle, L for lamina, and B for body. And then behind you have this spine of the vertebrae. But in between the pedicle lamina, somewhat over here, you have a running transverse process. So what actually happens is that when the rib comes and articulate, let me change the color over here. Okay, when the rib comes and articulates, the rib is articulating the body as well as the transverse process of the vertebrae. So it forms two joints. One is one joint over here and one joint over here. This is, imagine the rib. Okay. So rib has parts like head, neck, right? And it will have a tubercles which will articulate. So let us see. So head of the rib, which is attaching where? It is attaching basically to the vertebral body. The head attaches behind to the vertebral body. So head normally has two facets. One articulates with the vertebrae and other articulates with the above vertebrae. So that is another interesting fact over here. Now things are getting a bit complicated, but yeah, you will get to it. Now see what is actually happening. Let me look out for another empty space. And yeah, over here. So just imagine we are looking at an anterior view, anteriorly. Think about it. I'm making the vertebrae by this color only. This is one vertebrae, or say T4, and this is T5. Okay. This is T4, this is T5. What they are saying over here, that the head has two facets. One articulates with the corresponding vertebrae. So suppose it is the fourth rib that will articulate with the T4. So one head, the one facet will articulate with the same vertebrae and the other will articulate with the above vertebrae. So what does it mean? Suppose here I try to show you the fifth rib. So fifth rib, when the head of the fifth rib will come, this will be the head of fifth rib. Okay, this is the rib number 5. So in the rib number 5, its head will have two facets, 1 and 2. One facet will articulate the T5 and other facet will articulate the T4 lower facet. So fifth rib is articulating with the T4 and T5 both, the head of it. And what is between T4 T5 here? I guess you can imagine here we have the intervertebral disc over here, intervertebral disc. So again, I'm repeating, the head of a typical rib, say rib 5 over here, which is a typical rib, it will articulate with the T5 and T4 both. The head has two facets. So what will be this joint known as? This joint will be known as costovertebral joint. Costovertebral joint. Isn't that interesting? Right? Remember that. The questions have not yet come, but it can come that the fifth rib articulates with the which vertebrae. They can give you options like T4 only, T5 only, T4 T5, or T5 T6, options like that. You know, it articulates with T4 and T5 both. That will be a very good question. So neck, after head comes the neck. So neck connects the body with the head. The rest of the rib was the body. So we have the head over here at the top. Then the constructing part is known as neck. And in the body, in between we have the tubercles also. The body or shaft of the rib is flat or curved. The internal surface of the shaft has a groove for the neurovascular supply of thorax, protecting the vessels. Yes. So if you look at the rib, then inner aspect of the rib, the inner aspect of the body of the rib over here, it will have a groove for passage of neurovascular structures or neurovascular bundle. And this groove is known as, very importantly, costal groove. So is it present outside? No, it is present on the inner aspect. Understand? So once you palpate the rib, you're not palpating the neurovascular bundle. Else imagine, no, it will be very unfair, or it will be very unfair for the human body, so that on the outside you have the near nerve and vessels to supply the entire thoracic cage. That will be very problematic, no? Any injury and this is injured. So this costal groove is present on the inner aspect of the rib, and on the inner aspect runs the neurovascular bundles. Which nerves? Thoracic spinal nerves. Which vessels? The vessels supplying the thoracic cage, like intercostal vessels, both arteries and veins. They are present over there. Okay. Okay. So yeah. Now the atypical. So always remember, I'm giving you an idea that if there's a question regarding typical or atypical, remember that if you have a series of structures, for example, here you have T1 and going till T12. Always remember that above T1 is which vertebrae? C7 or C8? It is C7, and below T12 is L1. Always remember that in between, if you take the ribs in between, or the ribs only, yeah, T4, T5, or T6, T7, I think TT, but these are imagine the vertebrae and the ribs, right? I'm right now writing about the vertebrae, but we'll talk about the ribs. So if you understand that these are all the vertebrae, so above T1 is a C7 and below T12 is L1. Now ribs are attaching to it. No, that's why I started with that. So here we have the first rib that is attached. Here we have the fourth rib. Here we have the seventh rib, and here we have the 12th rib. So what are the features in this middle ribs, third, fourth, fifth, sixth, seven, eight, nine, 10, all those middle ribs, they will have a common feature. But if you go to the extremes, then obviously they will have different feature. For example, we have just seen that the fifth rib attaches to T4 and T5, right? But if you talk of the first rib, then it will attach to T1 fine, but above T1 there is no thoracic vertebrae, so it can't attach to C7. Therefore, the typical the typicality of the rib will be lost. So atypical structures are always found at the extreme. So you can see the upper and the lower ribs, they are atypical. They won't be having the same features of the middle 70 to 80% of the ribs. The middle major portion of the ribs are known as typical, and the upper and lower extremes of the ribs will be having a bit different features. So they are known as atypical. That's the whole point which you should understand. Then what are the different features that you can see over here? That rib 1 will only have one facet, as I just told you, that obviously it is not attached to C7. And rib 2 has a rough anterior surface where serratus anterior muscle originates. Rib 10 again will have one facet, rib 11, 12 will have no facet, right? So these are some problems over here. Articulation of the ribs anteriorly. Now here comes another point. How are they articulated anteriorly? Very important. We have discussed this, that first 7 ribs are attached to sternum. Therefore, let me put out over here that these first 7 ribs are also known as vertebrosternal ribs because they are going from vertebrae to sternum directly. The 8th, 9th and 10th, 8th, 9th and 10th ribs are indirectly attached to sternum via the cartilage. So they are known as vertebrochondral ribs. The rib number 8, rib number 9 and 10, they are known as vertebrochondral ribs. They are not attached directly to sternum, but indirectly via the cartilage. And rib 11 and 12 are floating ribs because they are not going anteriorly. We also simply call them as simply vertebral ribs because anteriorly they are not attached to cartilage or the bone. And ribs articulate posteriorly with these couple of joints that we will discuss. Costovertebral is the joint between what? Costovertebral is the joint between the head of the rib and the body of the vertebrae. Costotransverse will be a joint between the head of the rib and the transverse process of the vertebrae. And both of these joints will be which type of joints? Think about it. Take a rough guess. Both of these, which I have been asked in the last 3-4 years, they have been questions which came in your INICT, NEET PG. In the last 3-4 years, they are both synovial variety. In one of the exams, I remember, they gave an image of the thoracic cage, and the arrow was towards the costotransverse joint. And they asked which type of joint it is. They didn't label it as costotransverse joint, but the arrow was pointing towards it. And they are just asked which type of joint it is. The answer was it is a plain synovial type of joint. Okay. So this is the basic architecture. Now let us see a bit of ligaments also. So these ligaments will be dealt in your vertebrae, but obviously we have the ligamentum flavum. So this I will try to explain you in a different way. Don't worry. Okay. Here, let us see a couple of 2-3 vertebrae and understand the ligaments. We are looking at a vertebrae from the lateral aspect. So here we have the body, pedicle, lamina, and spine. Right. Again, going below, body, pedicle, lamina, and spine. This is anterior and this is posterior. So once you palpate, if you palpate the spine from behind, your fingers are on the spine. So this the spine is what you are actually palpating, but it is posterior placed. So what are the different ligaments? Understand. Now have a look at this carefully. Running anterior to the body of all the vertebrae is known as anterior longitudinal ligament. Keep that in mind. These ligaments, they hold all these 26 vertebrae in place with all the movement associated with it. They're very important. When you're running, jumping, whatever you're doing, they keep them in place. Running on the posterior aspect of the body of the vertebrae entirely is known as the posterior longitudinal ligament. Right? Let us label it. This was P for ped. Let me write the entire pedicle, and this is lamina. And this is the spine of the vertebrae. Now, other ligaments also. Through the lamina, this very flexible ligament that runs. that is known as ligamentum flavum. Ligamentum flavum. Then understand, through these spines we have a ligament that is known as interspinous ligament. So what we'll call it as? We'll call it as interspinous ligament, because they are between the spines. They are known as interspinous ligament. But the story doesn't end over here. There's one more small twist. What is that small twist? At the tip of the spine, tip, we have another ligament that runs, and that is known as supraspinous ligament. Supraspinous ligament. Similarly, between the transverse process also we have a couple of ligaments. These are major ligaments. I'll just revise it for you guys, don't worry. This is the body of the vertebrae running anteriorly. Anterior to the body only, we have the anterior longitudinal ligament. Let me write over here, anterior longitudinal ligament. Similarly, running on the posterior of the body, only the body is a posterior longitudinal ligament. Through the ligament, through the lamina, we have the ligamentum flavum, that is quite elastic. Through the borders of the spine, we have the interspinous ligament, and through the tip of the spine, we have the supraspinous ligament. There are a few ligaments that must know. And between the bodies, we have the intervertebral disc, which are actually the shock absorbers. They are the intervertebral disc. This was the lateral view. I repeat again. This is lateral. This is the anterior aspect. That is the posterior aspect. Don't miss the basic point. Okay. Now, if you come to this over here, so long ligaments that run the length of the vertebral column covering the body is fine, that we have seen. Okay. Flavum, remember lamina, and that is quite elastic. Interspinous, spinous, supraspinous, kind of tips. Okay, so these are 4 or 5 main ligaments that you should know for a vertebral column. This is the typical sternum shown over here. So let us label it. This is the manubrium part, that is the body, and that is exoxiphoid process. Here you can see the jugular notch or suprasternal notch over here. Let me use a highlighter. Okay. The first bone that is attached, that you actually feel, is the clavicle over. So this is the clavicle that comes over here. So you can feel the sternoclavicular joint. Then is the sternal angle over here. Which rib is attached? Second rib. Then you have third, fourth, fifth, sixth, and finally seventh rib going to the xiphoid process. Okay. Counting of ribs must know. See, if you are not finding it difficult to remember, all the revision is required, guys. Nothing you can remember by just listening or reading it for the first time. But the take-home message will be at least that you should start counting the ribs. Practical use. Always practical use is more important. Theory in itself has no use if you are not using it practically. Understand this. So whatever you are reading, understanding, try to apply it. Here you can at least start counting the ribs. Feel the suprasternal notch, the sternal angle, the ribs, and start counting them. Okay, it will give you a great amount of confidence. Here is the thoracic cage. So here all the things are shown with the sternum, all the ribs. So you can see over here that the 7th rib, and then 8th, 9th, and 10th. And 11th and 12th, they end over here only, posteriorly only they end. So these are our 11th and 12th rib. This is 11th, this is 12th rib. They end posteriorly only. They don't reach anteriorly. Okay. Floating ribs, false. Yeah, true ribs and false also understand. So true ribs are 1 to 7. They are directly. False ribs are 8 to 12. So this sort of simple question can come. Here is a image of the rib over here. This is the anterior end, the sternal end. So if they ask you what is attached over here, don't say sternum. Don't say sternum. It is a sternal end. But what will you answer? You answer, sir, here the costal cartilage comes. Their next question from the examiner might be, it is which type of cartilage? They will say, sir, it is a hyaline cartilage. Then the examiner might be satisfied by the answers. Okay. Then you have a body, and when the body rotates, it is angle. Why angle is important? Because this is the most common site of fracture of ribs. Whenever the ribs get fractured. Now, ribs fracture is also very common. A fall on the road, a fall on the anywhere, direct injury can fracture the ribs. So angle, it fractures. Then we have talked about the head, the neck, and then we have a facet for transverse process also. This will make costo-transverse joint, and body will make costo-vertebral joints that we have discussed already. Okay, so this is the rib over here. Now let us see a bit of costal cartilage. are present on the NT aspect of the ribs to provide the extension made up of high line. This is the question. First 7 pairs are connected with the sternum. 8th to 10th articulated with the lower part of the superior rib. So they were known as vertebrochondral ribs, if you remember. 11th and 12th, they are floating ribs, where they end up. Cartilage will also have two surfaces, anterior posterior surface. So don't go in, no, not necessary, just read it once, not that necessary to go into details of it. Human rib cage anatomy, this is the lateral view, but this is a right lateral view. Yeah, seeing anterior aspect and the post aspect over here. Quickly look at the change in the length of the vertebrae as well as that of the sternum over here. That is the anterior view that we already have seen already, right? Okay, now vertebral column, okay, that we have discussed. Let me show you an image, body and arch. Okay, I guess we have discussed more than that. Okay, that is not needed. Yeah, let me just jump to the joints over here. That is what is important. Here, let me just show you this image. Okay. If you look at this image, this is the whole vertebral column being shown to you, the spine. Look at this particular image over here, the right-sided image. If I just ask you, just imagine you are not seeing any labeling. This is, I'm saying it is a lateral view. So this side will be anterior or posterior is the question. Like if you're looking at a spine, you'll understand the spines are posterior, this side is posterior, and this side is A for anterior. And look at the curvature, beautifully drafted over here. Always remember that the cervical vertebrae have an anterior curvature or anterior convexity. And this over here, this will be a thoracic part. This is the thoracic part. Anterior concavity. And then this again will be the lumbar part, anterior convexity. So in a nutshell, thoracic vertebrae or the curvature of the thoracic vertebral curvature is anteriorly, it is concave. Point number one, anteriorly concave. Right. Second important question that has come from this thoracic curvature is that they are the primary curvatures. What is primary curvature? That they are present since the time of birth. Primary curvatures. So primary curvatures will be thoracic and your pelvic or the sacrum part. They are primary curvatures. The questions have also come regarding secondary curvatures. So whatever is remaining, secondary curvatures is cervical and lumbar. Anteriorly convex. They are secondary curvatures. Remember, they have been asked in question a lot number of times for your multiple choice exams. Okay. Okay. Now let us come to the specific joints of thorax. So in the beginning, I said that majority of joints are which type of joints? Majority of the joints are synovial joints. Why? Because you need changes in the diamond, changes in the volume of the thorax. If you have gone through physiology lectures, the respiratory system, again, there's pump handle movement, bucket handle movement, all that movements, no? Where there's lung expansion. Lung expansion is only possible with if there is rib cage expansion. Yes or no? If the bones does not expand, then what? How much? No matter how much the organs inside they start to expand, won't expand. No, organs are not that hard to break the bones and expand on its own. That is not possible. Okay. So for that, all of this, but let me come to this table. On this table, there's a lot of things which are written. Don't worry, I'll tell you the important parts which you need to must know, which are must know over here. That we'll try to discuss mainly. Joints. Okay, we should know the types of it, very frequently asked, and we should know that okay, that is between which bones. Okay, rest ligament comments later on, but first three columns they are must know. So first three columns over here, joint type, and it is basically between which bones. Simple. The important ones I'm now highlighting for you. Intervertebral, between the vertebral bodies. So what is intervertebral joint? First, after the name of joint, read the articulation. It is between the vertebral bodies bounded by the intervertebral disc. Midline joints are secondary cartilaginous. So very frequently, a secondary cartilaginous. Symphysis. Important question. Costovertebral joints we have seen between the head of the rib and the vertebral body. So head of each rib articulates with the superior facet of the vertebral body of the same number and inferior facet of the superior vertebra that we have seen. I'll just write over here adjacent to it that the fifth rib number 5. It articulates with the T4 and T5, so that you remember. Obviously, in T4 it will be articulating with the superior demifacet. In the T4 it will articulating with the inferior demifacet. That is what is written. But what type of joints are they? Again, synovial plane. Question. Costotransverse, again tubercle of the rib and the transverse process the same. Again, it is synovial plane only. So they have forgot to mention same over here. Both of them has come as question. Now another joint. Costochondral. It is between the cartilages and with the sternal end of the rib. Lateral end of cartilage with the sternal end of the rib. So it is basically between the rib and the cartilage. So as we have seen already, that when the rib comes anteriorly, it doesn't directly go to sternum. So here there will be a cartilage, costal cartilage. So this joint over here, this joint is known as costochondral joint between the rib and the cartilage. Okay, they are not mobile. You can feel them. They are primary cartilaginous joint. If you are feeling the rib, actually counting the ribs, basically you can feel the costochondral joint also. So then interchondral joint, what is that? Interchondral joint is between the costal cartilages of lower ribs, where they are only touched by the cartilages. Because below seventh rib, we have 8th, 9th, and 10th. But if you look at the anterior end, then below 7th costal cartilages like this, you have 8th and 9th and 10th. They form the what we say the sub xiphoid or sub angle, the subcostal angle, the costal angle. So here they are known as interchondral, again synovial plane. You can see maxima are synovial. You'll see the exceptions. Then very, very important comes the sternocostal joint. What is this? This is between, if you look over here, this is the sternum, right? And these are the ribs. Okay, so all these joints over here between the costal cartilage and the sternum, these are your sternocostal joint. Sternocostal. Now here you have very, very important questions. What are that? That the first that is between the first rib. This is imagine the first rib. So this joint over here between the first rib and the sternum. This will be again be a primary cartilage. Now this doesn't move. So basically the manubrium and the first rib, they don't move. They're forming a immobile joint. Understand? The manubrium and the first rib, they are actually forming a primary cartilaginous joint. So that is a question. But the other joints over here, they are again synovial variety. So these will keep on moving other. But the first one, that is, this one is primary cartilaginous. Here you have the PC primary cartilaginous, and these all will be SY synovial. Sternoclavicle, we already have seen that is part of the upper limb, but yes, saddle variety. Manubriosternal, so again, sternal angle area. So this was the manubrium, that was the body. So this joint is manubriosternal. Midline, secondary cartilaginous. Secondary cartilaginous. So these are few joints that you should know that from where to where they are located. But yeah, below here you can call it as a synchondros. It is known as the sternal joint. Xiphoid, yes, this is last one is the sternal joint. So that is again actually it forms sometimes this body and xiphoid, they fuse to single bone. So this is known as your primary cartilaginous synchondrosis. Now I know you might be a bit worried, but don't worry. Let me try to show you in this image only what are the different joints. Okay, so red color I am making the, just to differentiate, we will only make the cartilaginous joints. The rest all are synovial joints. So this was rib 1 and the sternum. Which joint was it? It was primary cartilaginous. I'm writing it as red color is primary cartilaginous. So this is primary and this is primary cartilaginous. Yes or no? And if we choose a different color, say purple color, then this is secondary cartilaginous. This is secondary cartilaginous. Right? And the costo, just a second. Primary cartilaginous, let us add this one also, no? This the costochondral ones. These are also what? Primary cartilage. So this red and this purple color that you're seeing, purple color let us make behind also for the intervertebral disc. These are all. So the red color, let me just try to label the purple is secondary cartilaginous, and the red color is denoting the primary cartilaginous. So This is first sternocostal. If you want me to write, let me write that also. First sternocostal. This is your costochondral between the rib bone and the cartilage. And this is your xiphisternal ZX.S joint. Okay. Purple color over here, was your manubriosternal joint. So just imagine, apart from all of this, all the other joints are synovial. Now, what joints are left? Let me show you from the front. These are all the sternocostal joint, in the ribs and the sternum. Behind we can't see from here, but understand that each side we have you have two costovertebral and one costotransverse for 12 pair of ribs. So lot of joints behind that is junction between the vertebrae and the ribs. So junction between the vertebrae and the ribs, they are mainly all in all synovial only. And entirely when it means maximum to movement over here, sternocostal, except the first one, they are all synovial. Understand? So just go through this table, and as I said that, okay, focus mainly on what is the type of joint and what does it actually mean and which type of joint it is. Focus on here only. Then you can later on go to the comments. So as you can see that maximum number of joints over here, they are synovial. They are synovial. Just few exceptions over here. One is this first sternocostal. One is this costochondral. See, if these start to move, and imagine the costochondral, why are they your cartilaginous? If they start to move, the rib will start to break. Because this whole process is because, see, this is the sternum, okay? Just be with me for a second. And this is cartilage plus rib. This is cartilage plus rib. Single color. Now, understand the maximum movement when you inhale deeply is over here. Sternocostal joint. That is fine. Now imagine if suddenly here also the movement starts to occur, won't the rib break? Yes or no? Therefore, they are cartilaginous. And over here in the center, they are synovial. Sternocostal is synovial, and costochondral will be cartilaginous. Understand practically also all of this, right? So this was about the joints of the thorax, thoracic cage. So this is what we started with. Just to recap all of the stuff, what we have done from the beginning. Joints, understand first of all, the go bit back, have a overall picture of what the thoracic cage is, what are the structures that are deep to it, why is there too much of movement? Because the organ like heart and lungs are dynamic, not like the brain. Then look at what are the various bones, where are the joints, and what type they are and why they are that type. That is also important. Then start palpating, guys. This is all practical, theoretical knowledge, but have some practical knowledge also. Feel the ribs, count the ribs, feel the sternum. Behind, feel the vertebral spine. This is all the body, right? So tonight, at least, you should know how to palpate the ribs. You should palpate the sternum. You should palpate the vertebral spines. Trace the ribs from front to back. Trace it. Okay, this is rib 7 going, and behind, okay. So here I am somehow feeling the T7 spine. Do this, okay, on both the sides. And that will give you a very good insight into this topic. Okay, then read it. Then read it. So do the practicals simultaneously. And if you have any problems, then do us in the comment box. We'll be more than happy to answer. And then we will move to the other topics that is inside the thoracic cage, the mediastinum, heart, lungs. They are basically thorax. Volume-wise is quite a small compared to abdomen, head, neck, and all that. Okay, that will done easily. But revise it, and any problems do ask us. That's all. Good night. Bye-bye. Take care. Thank you.